Before we know it, it'll be back to school and back to those Friday night lights and fall sports we all love. But if injuries are in the back of your mind, how can you manage the fear of it and protect your star player?
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist Health Talk.
Welcome to a new episode of Baptist Health Talk, where we answer your most searched questions on the internet. Today's topic is safety in sports. I'm Willard Shepard, your host for today. Now, to talk about safety in sports, we are joined by Dr. Richard Morgan, spine care physician at Baptist Health Miami Neuroscience Institute, and Dr. Michael Yurubi, sports medicine physician at Baptist Health Orthopedic Care. Thanks to both of you for being here. And before we dive in, I want to remind our viewers to send in your questions and comments in the comments section as you watch. We're here for you and happy to answer any of the questions you might have. So, gentlemen, let's dive in. First of all, Michael, what can you do as a parent? This is the type of year we talked about, 2-a-day football practices starting, these types of things to protect your child.
So I think really important, maybe overlooked, is teaching them how to stretch, how to warm up, properly properly how to cool down. Knowing the technique of the sport is very important. So with football, knowing not to hit with your head down, knowing the equipment. I mean, making sure the equipment fits right, making sure the mouth guard fits right, the helmet, and then proper nutrition is always extremely important, not overlooked. And also hydration. Hydration is very important as well.
This time of year, what are the most common types of injuries that we see?
It really depends on the sport. So, in football, knee injuries like ACL tears and injuries are more common. Also in football, concussions are more common. Same thing with soccer, especially women's soccer. Concussions are very prevalent. Basketball, ankle injuries like ankle sprains are very prevalent and common. And so it depends on the sport. Overall, knee injuries are the most common.
Mm-hmm. How can the heat that we're all dealing with, especially here this time of year, impact this overall?
I think in general, you see more muscle cramping, you see more fatigue. As you're fatigued, you're more likely to you're more likely to injure yourself. Since your technique is not normal. And
just to piggyback off of what Dr. Yurubi said, people with sustained a concussion are more likely to have a knee injury. I think it's about a 2 to 4% increase, 2 to 4 time increase in knee injury and musculoskeletal injuries in people who sustained a concussion. So it's one thing to keep in mind.
I have a question about that. And what is the correlation? Because those of us that are lay people would think, okay, how would a concussion impact an orthopedic injury?
That's a great question. After a concussion, a lot of patients have vision changes, double vision, imbalance, dizziness, and the coordination is lagging, especially compared to the healthy version of themselves. So when that happens, the gait changes. With gait changes, you're more likely to injure your ankle, your knee, your hip. So there's been a lot of research showing that there's an increase in knee injuries after a concussion, and it's mostly because of those symptoms that arise after a concussion.
You're mentioning the concussions, and there's been a lot of focus on that. Where are we with that in terms of learning more about it and being able to actually do something about it?
There's been a lot of growing research, mounting evidence for the consequences of concussions and repetitive impacts. CTE has garnered a lot of attention in the media and through movies. And so I think there's been a lot of research that's kind of followed along with that media attention. And so it's also drawn a lot of attention to professional and collegiate sports too. There's been rule changes in the game. For example, football, there's been a much greater emphasis on spearing and illegal hits with the helmet, head-to-head impact. So,
Dr. Morgan, you mentioned all the things and the technology that's coming forward to try to stop concussions and head injuries. Talk about this protection device here that can come off the helmet, our FIU helmet here, and the important role it's playing now.
Yes, this is the Guardian cap. It's a thin piece of padded material. It's lightweight. It goes over the helmet. and it was introduced in collegiate practices several years ago. And the idea is that the padding on this thin material absorbs the energy that's transferred from head impact. So if you think about an offensive lineman who sustains about 70 to 100 head impacts throughout a game, if you're able to reduce some of the burden from those head impacts, that can make a major difference throughout a career. So this is one of the newer technologies that's aimed towards reducing concussions and head injuries in football.
How effective are these, and what does the research show, whether it be at the junior high school level, high school, or collegiate level, about how effective this device is?
Most of the research has been done at the collegiate level, and it's been going on for the past few years, and it has been shown to be very effective, and has significantly reduced concussions at the collegiate level. And that's why it's being introduced now into games at the professional level.
Okay. In terms of a concussion in general, whether it's, there are very few people that are actually out participating in football activities, but in the general population, how do we know when we've had a concussion? What are those signs?
Well, concussion, the common misconception is that there has to be loss of consciousness or somebody has to pass out for there to be a concussion, but that's not true. We know that to not be true anymore. Some of the symptoms that are common are headache, dizziness, double vision, blurry vision, nausea, vomiting, imbalance, fogginess, confusion, and those are some of the immediate symptoms. Now, a day or two later, you might notice that the person who's sustained a concussion has difficulty sleeping, anxiety, they might feel down or depressed. And so this is something that you really want to address immediately right off the bat. And that's why it's important to identify it right when it occurs. That way we can prevent the length of time that this patient or person has these symptoms.
Okay. In this world, over at FIU, there are a significant number of professionals out there to making sure that the practices are run in a safe and effective manner. But for the normal person that says, I'm going to go out biking today, I'm going to go out on a run today, what should they do prior to the actual exercise activity and post-exercise?
Yeah. So warming up is really important. Warming up increases your heart rate, which in turn gives more blood flow throughout the muscles, brings more nutrients to the muscles, and then kind of it optimizes to be able to optimize their performance. Warming up can start with something as simple as just 10-15 minutes of doing jumping jacks. You want to do more of a dynamic warm-up, meaning that you want to do some jumping jacks. You want to do something that is going to be used during the sport, so get your body ready for the sport. I think it's mentally important as well, because you're able to see, you're able to mentally prepare yourself for the activities that you're doing. And then it also helps with the range of motion, lubricate your joints, stimulate some synovial fluid into the joints to help with some range of motion. So you want to do more dynamic stretching before. And then after, for cooling down, after your sports, you want to reduce that heart rate. You could do a light walk, a light jog, reduce that heart rate, and then do more of a static stretching. So static stretching helps reduce some of that lactic acid, and it helps you, to be less sore the next day. So,
when it comes to water and hydration, the importance of it in any of these activities, especially now.
Mm-hmm. So we recommend an 8-ounce glass of water every 20 minutes. That's especially important here in South Florida. It's extremely hot, especially this time of the year, and a lot of the sports that occur or ongoing this time of the year require a lot of aerobic activity, especially in training. So that's something that's really important to stay on top of. If the training or the activity is going to go on for a prolonged amount of time, we recommend a sports drink with carbohydrates. That way you can replenish the energy within your system that's flowing. So
some of those types of drinks can be productive as well, but water always a great way to go.
Exactly. Yes.
Okay.
Mm-hmm.
Is it true that you try to drink as much water as you possibly can, and there's no such thing as having too much water?
That's not true. So We know from runners that there are some symptoms and issues that can arise if you drink too much during a marathon per se. That can cause other issues. So really, you want to meet that demand of 8 ounces every 20 minutes. That should be sufficient and allow you to keep on playing and reach optimal levels of competition.
Okay. I feel like from our conversation, doctors, we've been out there working out, and we've actually had our own workout here. So now to resting. And people that are competitive athletes, and I'm a very competitive person, and those types of things, can we overdo it? What about getting the proper amount of rest?
For sure, yeah. So rest is very, very important. I think it's very important to rest, especially right before a tournament. So you're working up, we're exercising a lot before the tournament. I think it's very important to be able to rest a couple days before some sort of big competition. It's very important to rest after the competition. A big competition, a lot of teams will have the day off the next day. Also very important to rest during transitioning from seasons. So from one season to the other, it's extremely important to rest, not just kind of all year round play. And also very important to rest when you're having any kind of overuse injuries, any kind of stress injuries, any kind of tendinitis. So rest in general is extremely important.
What's being done as we approach the start of the school year and these type of intense athletic activities to protect our young athletes and people participating?
Well, I think there's been a lot more emphasis on protecting these athletes. If you look at the old highlight films, especially in football, most of them are cut-ups of big plays, big hits. And a lot of those hits are head-to-head impacts. So nowadays, we know the potential consequences of those head impacts. And so there's been a lot of rule changes, which I think are key to preventing major injuries, especially concussions. And those rule changes have changed a lot of the exercises and activities that are done in practices. So it's also been a lot more emphasis on proper technique during practices. So I think that combination has set us in the right direction in preventing major injuries in sports.
How can the average athlete, a person that's not a professional and they're not operating in a collegiate or interscholastic environment, learn from this, and what should that person do?
Yeah, I think listening to your body is very big. I think, listening to your body, making sure you're not kind of pushing through some injuries, some overuse injuries that can potentially make it worse if you just kind of push it through it. And just what Dr. Morgan was saying, I think a lot of it is just introducing a dialect between your athletic trainer, your coach, to be able to prevent these overuse injuries, and being able to open up and say that my knee's hurting or something, and so you're not pushing through a lot of this.
Okay, we want to hear from each of you about what we'll say is your top few things of advice you have for us, for parents or athletes themselves.
Yeah, so I think being able to open up that dialect, like I said, making sure that the athlete is talking to the parents, to being able to feel like they're able to talk to the parents if something is hurting them, and to be able to not prevent these long-term injuries. I think that's one of the things.
Dr. Morgan?
So I have a few things that I would recommend against. Number one is returning to a sport prematurely. That could potentially lead to even bigger injuries in the future. I think the days of just rubbing dirt on an injury and moving on are over, and we now know that bigger issues can come about when we do that. Number two is being restricted to only one sport. So I think there's a lot of benefits to playing multiple sports throughout the year, and that's another way to prevent injuries long term. And number three, as a local Miamian and a big fan of the local sports team, I don't think I would be able to let my child support that team in the Northeast near Boston, especially in football. Not to name names, but
we got it and we understand. So thank you very much, and we really appreciate the time and the advice. Extremely important, especially with the heat and the environment and the climate in which we live. and also the competitive nature in so many of us. We have to make sure that that's done safely and keep all of that under control. So thanks to both of you. Great conversation. Thanks for sharing this insight with our audience. Again, remember, viewers, to hit that subscribe button on our channel, here to keep up with the latest health and wellness information and also tips from our experts. And thanks for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.